With respect to this specific patient, this is a young patient with what we would call classic HNPCC, hereditary nonpolyposis colorectal cancer syndrome, actually also known as Lynch syndrome, because there also is a very strong family history of not only colorectal cancer, but extracolonic cancers that are classically associated with HNPCC and the Lynch syndrome, namely cancer of the endometrium as well as cancer of the stomach. This patient presents with metastatic colorectal cancer with what appears to be liver-limited disease. Based on the patient's young age and no presence of comorbid illnesses, this is the kind of patient where we would want to be very aggressive with respect to offering systemic therapy, which should involve both combination chemotherapy as well as a biologic agent. With respect to making the diagnosis of HNPCC or Lynch syndrome, the classic approach to making the diagnosis is to assess the presence or absence of microsatellite instability. This is a fairly laborious, labor-intensive approach using very sophisticated PCR-based techniques. Now, actually, there are two other approaches where we can make the diagnosis of HNPCC. One is to actually have either the patient's tumor or the peripheral blood of an individual patient undergo sequencing analysis to look for mutations in the 5 different mismatch repair genes. The other approach, which has been done, is to actually look at the presence or absence of the expression of 2 of the main mismatch repair proteins, MLH1, HMSH2. When Dr. Lynch first described the Lynch syndrome, and interestingly enough, he did this with his wife, who was a nurse, quite some time ago, even before there were any genetic approaches to make the diagnosis. There was Lynch syndrome 1 and Lynch syndrome 2. Lynch syndrome 1 was purely confined to patients with colorectal cancer, whereas Lynch syndrome 2 was colorectal cancer plus extracolonic cancers. And those extracolonic cancers include cancers of the stomach, the ovaries, the uterus, the small bowel, the uroepithelium, the kidneys. So there are a wide range of other cancers outside of the colorectal region that are involved with the Lynch syndrome too. With respect to testing for the Lynch syndrome, probably the definitive approach is to get peripheral blood and to do germline testing to see whether or not there are mutational events in any one of the 5 mismatch repair genes.